Let's begin with 2 or 3 definitions that I think are important. The first one, of course, is what is pharmacy? Pharmacy is the art or profession of preparing and dispensing drugs and medicines. The art of preparing drugs and medicines. It's truly at the root of our profession. It's a responsibility that we have that I believe in today's contemporary healthcare team that we can provide a rather unique service. Some years ago, I guess 5 now, the National Association of Boards of Pharmacy and the Federal Food and Drug Administration got together and determined that we needed some specific definitions as to what is clearly manufacturing and what is compounding. I would call to your attention in this rather long definition of manufacturing that there are 2 key items. The first key item is that you are considered a manufacturer if you promote and market the product or device that you are providing, if you promote and market that product. Secondly, if you make that product available for resale by others. Those are the key elements in the definition of manufacturing. If you promote and market the product, and if you make it available for resale by others. Unlike the definition of compounding, it is a direct result of a practitioner's prescription drug order. What a compounding pharmacist does is provide an opportunity for that prescriber to utilize the skills and abilities of that compounder to provide an alternative to a manufactured product. But yet those services can only be provided if, in fact, that pharmacist has received a prescription drug order from that prescriber. And then the second item is in the second paragraph, which states that you can bulk compound, however you're limited to do so based on the anticipation of prescription drug orders that you have seen on a regular and routine observed pattern of prescribing. By that I mean if Dr. Jones has, for a period of the last 3 to 4 months, prescribed a specific formula, perhaps for a cough syrup, and you know that every month you more than likely will dispense 10 or 15 prescriptions for this particular formula, then by this definition you are allowed to anticipate those prescriptions and in fact compound those 10 or 15 prescriptions in advance. It does not mean, however, that should you receive that first prescription from Dr. Smith and you realize economically it is much better to your advantage to compound a gallon when 8 ounces is prescribed, and you will hope that the balance of the gallon will eventually be prescribed for, you cannot do that. There are some stability issues that enter into that equation, and I think that the integrity of the profession is at stake, so we must realize that bulk compounding can only be based on routine and regularly observed prescribing patterns. Well, all of this can only take place if the triad relationship is in place. By that I mean the physician and the pharmacist working together with the knowledge of the patient to assist them in overcoming their difficulties due to the unavailability of a medication specifically for the need of that unique patient. So the triad relationship must remain intact, where the pharmacist working together with the physician to help that patient overcome their non-compliance issues. Who are those individuals that we can help? Well, it's virtually limitless. Who are the prescribers in your marketplace? Let's begin by highlighting 1 or 2. Certainly all medical practitioners have a need. I would suggest to you that you could challenge any medical practitioner in your community, and on a regular basis, if not daily, they have 1 or 2 patients that are challenged by non-compliance issues that should you be able to provide them with an alternative, they could overcome those issues and realize better therapeutic outcomes. A good example might be pediatricians. Those of you who've worked with the pediatric patient realize that taste oftentimes enter into the equation and becomes a problem for many patients. Even those that are taking some wonderfully flavored antibiotics, but a child now perhaps is a chronically ill child taking a cherry-flavored medication on a regular basis, gags at the thought that they'd have to take that cherry-flavored medication one more time. Wouldn't it be an ideal tool for you to provide that child with an option as to what medication flavors might be available. Most compounders can offer up to 74 different flavorings. As a matter of fact, one of our compounders in Houston has developed a whole specialty practice in pediatric medicine, working with those children that are non-compliant due to taste, where the child comes to the pharmacy and actually taste tests and determines which taste the medication should be at this particular refill. It certainly is an area a lot of pharmacists have been able to help those pediatric patients. How about a unique dosage form? Perhaps using the lollipop dosage form as an alternative to assist that very difficult child to take their medications. So pediatric patients certainly do have some needs. Dentists have needs, veterinarians. Certainly goes without saying, as a matter of fact, that veterinarians have some substantial challenges. I'm told of the story of a pharmacist in Philadelphia challenged by a veterinarian at a zoo, where the veterinarian had just received the hippopotamus as a gift to the zoo, but yet the hippopotamus had been suffering for the past year with fungal toes. And that's a real difficult issue for a hippopotamus, as you can well imagine, where the hippopotamus is kind of lying around and standing around in the muck and mire all day. You can imagine it's very difficult to get medication to the area of need. So the pharmacist was challenged with how can we get the antifungal agent to the toes of that hippopotamus and allow it to stay in contact with the damaged tissues long enough to get relief. Well, he determined that by using the base that is normally used for dental adhesives, such as a proprietary product like Dr. Wernitz, that base, the Polyox B base is called, using that as the base in the formula, mixing it with the antifungal agent, the veterinarian then could actually blow powder the medication in between the toes of the hippopotamus. And within 12 days, the hippopotamus was cured of a condition that otherwise it had been suffering with for over a year. So veterinarians have some very unique challenges. Geriatric caregivers, goes without saying, as a patient ages, as their body weight changes, as their physical disability is enhanced by their handicaps, they become an extreme challenge for those who would provide them with dosage forms. Hospice caregiving, probably the most professionally rewarding component of compounding pharmacy. I'm reminded of the story of a dispensing community pharmacist who for 15 years had dispensed prescriptions and doesn't recall the first phone call where the patient actually thanked him for the fact that there were 100 tablets in the bottle, but has been working with the hospice programs in his community for the past 7 years, and today has a drawer full of thank you notes from caregivers, from loved ones, where he was able to positively impact the final days of the lives of their loved ones, because as a compounding pharmacist, working with the physician, they were able to offer some rather unique alternatives to their therapy.